Now that in vitro fertilization has been recommended as your best option for achieving pregnancy, you need to be informed about all aspects of the process. In this video, we will try to answer most of your questions about IVF. This will help prepare you to participate in the program.
Information process, the training of us to know what we're going through is invaluable, so you're not kind of surprised that, oh, okay, well, now we have to get this shot. It's all laid out for you, so it's really explained well, and if there is a question, then you definitely have the resources to have it answered.
We always felt like when we'd come in that whoever we were talking to pretty much knew our story, and we always felt like we were either with friends or family, so it wasn't like we were left out, you know, as a number or just a patient. So that was always a good time for us because we really felt supported throughout and just kept up to date about really everything, and not really information overloaded, because when we were given the information it seemed like it was just really appropriate timing. You know, it wasn't too much at once.
As we went through the IVF cycle, we truly just felt like everybody, from the receptionist to the nurses to the doctors, everybody was so just kind and caring, and everybody truly wants you to be pregnant and holds your hand and feels just like you do when it doesn't work and is excited with you when it does. So it's a great feeling. It's like kind of your extended family.
An ovary normally releases an oocyte, also known as an egg, once a month. And when the fallopian tubes are open and working correctly, the tube picks up the egg and moves it toward the uterus. The sperm meets the oocyte in the tube and fertilization occurs. This is when the sex of the baby is determined. The fertilized ovum is then transported down the tube into the uterus where it implants. The entire process takes approximately 7 days and is dependent on not only normal ovulation from the ovary, normal transport of both the sperm and the egg, but also on preparation of the lining of the uterus, the endometrium, to allow implantation. The most common reasons for referral for in vitro fertilization are tubal blockage, sperm issues, endometriosis, premature menopause, or unexplained infertility failing treatment. These are not the only reasons for IVF, and you may have a different factor causing infertility. Most of you have already had several diagnostic and therapeutic procedures performed during the course of your infertility workup and therapy. Some of these procedures may have been uncomfortable, and the results of your treatment may have been frustrating. You may want to talk to a social worker or a counselor about these feelings. We're sensitive to this, and will try to help you as much as possible. Many find this is a time of hope and strong emotion. We will ask you to meet with our clinical psychologist who can help you with the emotional aspects of the process. Once you have decided to participate in the IVF program, 3 additional tests are required of the male and female. For the male, a recent semen analysis is performed in our lab. For the female, an assessment of the uterine cavity and a series of blood tests called a clomiphene challenge test. The clomiphene challenge test requires a blood test on cycle day 3 to measure the hormones FSH and estradiol. Then, clomiphene citrate is taken orally from cycle days 5 to 9, and a repeat FSH blood test is done again on cycle day 10. This test ensures that the ovaries have not begun to enter a premenopausal state in which the ovaries contain less viable eggs and therefore diminish the likelihood of a successful IVF cycle. The IVF cycle can be divided into 4 phases. The ovulation induction phase, the oocyte or egg retrieval phase, the embryo transfer phase, and the implantation phase. Fertility drugs containing the hormone FSH are commonly used in the ovulation induction phase and help increase the success rate for IVF. Lupron, or Antigon, inhibits the body's natural release of the hormones LH and FSH from the pituitary gland. thus preventing the pituitary gland from triggering premature ovulation before the oocyte retrieval. FSH stimulates the ovaries to develop many eggs at one time. This improves the chance of pregnancy multifold. Although we use several different stimulation protocols, our most common one is referred to as the Lupron long suppression protocol. The ovulation induction phase begins on the 5th day of your menstrual cycle. On that day, you will begin an oral contraceptive pill. After about 12 to 21 days of pills, you will begin daily injections of Lupron at home. After approximately 2 weeks of Lupron therapy, you will return for a pelvic ultrasound, a urine pregnancy test, and a serum estradiol or estrogen level. This last test will show whether your ovaries have been adequately prepared to begin stimulation. If the level of estradiol is low enough, then you will begin FSH stimulation. These injections will also be given at home at the dosage your doctor prescribed. You will continue the Lupron therapy, but your doctor will reduce the dosage. The average FSH therapy lasts 8 to 12 days, but may vary depending on your body's response. We will carefully monitor the FSH therapy through frequent blood tests to measure the blood estradiol level and pelvic ultrasounds to measure how the follicles containing the eggs are growing. The egg grows in a fluid-filled cyst inside the ovary called a follicle. As the egg matures, the follicle increases in size, which is measured by ultrasound. This monitoring is important because it will help your doctor measure your response to FSH therapy and time your egg retrieval procedure. The blood tests and ultrasounds will be performed in the morning at the UF Reproductive Medicine Office at Spring Hill, or may be arranged at one of the affiliated satellite centers. You need to be available every afternoon for a phone call while you are on these drugs so that we can adjust your FSH dosage if necessary. When the blood estrogen level is adequate and your follicles are large enough to begin the egg retrieval process, you will receive an injection of human chorionic gonadotropin, abbreviated HCG, at home. This helps the eggs mature. 36 hours later, the eggs or oocytes will be retrieved. During the oocyte retrieval phase, the eggs are removed from the ovary. While under sedation, the retrieval is performed in a specialized procedure room at the Spring Hill office by inserting a needle through the vaginal wall for a short distance into the ovary under ultrasound guidance. During the retrieval, fluid from the follicles is aspirated into a test tube, and an embryologist scans the fluid under a microscope for the presence of oocytes and grades the eggs for maturity. During this procedure, you will receive medication so that you'll feel little or no pain. After a few hours, the oocytes are inseminated with sperm, which have been prepared from a semen sample obtained that morning. If poor fertilization occurs or problems with fertilization are anticipated because of low sperm counts, a special procedure called intracytoplasmic sperm injection, or ICSI, may be performed. With this technique, the zona or shell surrounding the egg is penetrated with microscopic instruments, and a sperm is injected directly into each egg to help fertilize the egg. The next day, the oocytes are examined for evidence of fertilization. Donor eggs are available for women who do not have ovaries, who have gone through premature menopause, or who have very poor chances of success using their own eggs, such as commonly occurs in women who are over the age of 43. Oocyte donors are recruited locally and screened with genetic and medical histories as well as infectious diseases. All donors are between ages 21 to 30 to ensure maximal pregnancy rates. Donor oocyte recipients do not undergo FSH stimulation, but are placed on a special Lupron and estrogen protocol to synchronize uterine development with donor egg development. 24 hours after fertilization, the embryos are examined for evidence of cellular division. If the embryos are dividing normally, you will have embryos transferred 3 to 5 days after oocyte retrieval. The number of embryos transferred will be guided by the quality of the embryos, your individual prognosis, and timing of the transfer, as determined by national guidelines published by the Society of Assisted Reproductive Technology. These guidelines are available in your informed consent form. In certain cases, it may be advisable to open up the shell or zona surrounding the embryo to assist implantation of the embryo in the uterus. This is called assisted hatching. If there are any remaining embryos, you may choose to have them frozen for future transfer. The transfer phase involves transferring the embryos back into your uterus by passing a small catheter through the cervix into the uterine cavity. This is usually a painless procedure. You may resume light activity the same day and return to your full schedule the following day. The next phase, the implantation or luteal phase, is the time between the egg retrieval and the pregnancy test. During this phase, you will be taking progesterone injections daily to prepare the uterus for implantation of the embryos. 11 days after embryo transfer, a blood pregnancy test will be performed. We will also be watching for any complications including tubal pregnancy, multiple pregnancy, infection or bleeding, and hyperstimulation syndrome, the risk of which occurs in less than 1% of patients. This hyperstimulation complication is a very rare side effect of FSH therapy. The risk of tubal pregnancy is about 3% of all pregnancies, multiple pregnancy in about 30% of all pregnancies, and for infection and bleeding the risk is very low. Women who elect to transfer a single embryo will further reduce these risks. Obviously, the IVF process will require a great deal of your time and effort. The process involves a time commitment almost daily for about 6 weeks. And of course, you may have conflicts with your work and home routine during the monitoring, the injections, the frequent phone contact, the surgical procedures, and the follow-up. The IVF nurse coordinator and other members of the IVF team will guide you through the medical aspects of the procedure. The cost of the procedure may vary, but will usually total from $10,000 to $14,000 for IVF, including drugs and monitoring. Although embryo freezing and micromanipulation of sperm or embryos will have additional charges. The amount of medication and monitoring you require will influence the overall cost. A financial counselor at the Spring Hill office will guide you through the billing and insurance aspects of the procedure. In our experience, insurance companies have varied widely in the proportion of the bills that they will cover. The financial counselor will talk with you individually. She will verify your insurance and will inform you of the percentages and amounts you will be required to pay as you advance through the IVF procedure. You will need to contact the IVF nurse coordinator to find out the dates of the current IVF cycle. There are 4 10 to 12 week IVF treatment cycles planned each year with definite start and stop dates. After the screening tests have been performed, you will need to obtain consent forms to read at home at your leisure. Do not sign the consent forms. Just bring them with you to the IVF orientation. During orientation, any final questions you have will be answered. At this time, the appropriate consent forms will be signed with the doctor. You will also be taught the technique of subcutaneous and intramuscular injections, and you will perform a test injection of sterile water under the supervision of the nurse.
You know, this is normal. This does happen to a lot of couples, and thank goodness there's medical science out there that, you know, can help people like us and did help people like us. So never give up. Never, never give up. It may take you 1 cycle. It may take you 4, like in my case, and then the next baby, it was first time. So just don't give up and always stay positive.
This has definitely changed our life. We're going to be having a healthy baby boy here soon. So we're 34 weeks pregnant and everything's looking fantastic. So this has been the most positive experience I could have ever imagined, and I'm just really, really happy that we came here and got to be with the staff that, that took care of us, because they really did a great job.